Hello, welcome to all of our participants today for this virtual town hall. We're going to give just a few more minutes for people to join, and then we'll get started in just a minute. All right. Welcome, everyone. Thank you for joining us today. I am Erin Stieber, the Senior Vice President of Programs at SmileTrain, and I am joined here by colleagues from around the globe to talk about some of the telehealth and virtual education programs that SmileTrain partners and staff have been supporting during COVID-19. Before I introduce our panelists, I wanted to give just a little bit of background for those of you who aren't familiar with SmileTrain. SmileTrain is the world's largest cleft lip and palate organization. We partner with local medical professionals in more than 70 countries around the world to provide funds, equipment, and training to ensure that children and adults with clefts have access to safe surgical and anesthesia care in their own communities. Of course, while cleft lip and palate is a surgical condition, there's also a lot of vital ongoing care beyond surgery that's necessary to ensure that patients have optimal surgical outcomes and can lead happy, healthy lives. So we also partner with medical professionals to provide an array of comprehensive care like nutrition, speech therapy, dental and orthodontic care, and psychosocial support. COVID-19 greatly impacted our programs and our partners around the world. To protect the patients' and providers' safety, many cleft surgeries were postponed, and in-person visits for comprehensive cleft care were often not possible. My colleagues will go into more detail about the impact on each of their regions, but throughout our global programs, we saw a sudden and urgent need for virtual services. Even during a pandemic, a baby is born with a cleft every 3 minutes, and their families need guidance and help to ensure that the baby stays healthy. For so many patients, nutrition care couldn't wait. Speech therapy couldn't wait. Since our partners are on the ground in these communities, they were able to mobilize incredibly quickly to provide a lifeline of services to these patients. COVID also, of course, impacted the training and education opportunities that are so important to build the capacity of healthcare workers. We have postponed more than 50 in-person trainings over the past few months and are continuing to be forced to postpone some in-person trainings. However, we've been very fortunate to partner with some outstanding groups that my colleagues will speak about in order to really grow education and training online. So without further ado, I will introduce you to the panelists. Today you'll hear from Mamta Carroll, who is our Vice President and Regional Director for Asia, Kimi Kosatang Flaviano, our Area Director for Southeast Asia, Diane Arquiaga, our Program Director for South America, Camila Ferreira, our Program Manager for Brazil, and Dr. Nicole Buba, our Program Manager for Central Africa, our CMAC zone. They'll give an overview of COVID in their regions, the telecare or remote care programs partners have initiated there, and then we'll discuss some of the challenges, solutions, and lessons learned from these programs. If you have any questions, please use the Q&A function to ask them. We might have some time to answer them live, but otherwise we'll update the event page with the responses. And now, Mamta Carroll, our Regional Director for Asia, will start us off with a discussion of a very special helpline in India.
Thank you, Erin. Thank you for the introduction, and thank you for telling the viewers about what work we do and where we are placed. Thank you for the opportunity. I'm going to talk to you about a helpline and how really important communication at this time of the pandemic is so very important, especially with a cause like clefts, where there's so much of in-person contact with the patient, with the families, with the doctors, with the teams, and then when everything comes to a standstill, what is it? What does happen? What happens to the patients? What happens to the doctors? What happens to the parents? This is what I'm going to talk about. So I'm going to briefly talk about the helpline and a little bit about the situation in India. So as all of you know, that India had the first, confirmed COVID-19 case in the end of January, but it was not until say March that the government declared and decided to do a lockdown. And like other countries, there was a very peculiar state in India where they just gave us like 48 hours notice to wrap up everything, get into our homes, shut up the offices, and that's it. So here was a great challenge because, India has a very small office, and we have a very important aspect of cleft care, which is called the toll-free helpline. It is a physical little box in the office. You can see my helpline officer on the screen. Her name is Gomti. And there's a very small, a very simple equipment that is the helpline. So when we were given just 48 hours, we obviously didn't know how to handle the situation. And then we had to really make some very quick changes and quick decisions that we wanted this helpline to be accessible and available, especially in this time of the pandemic, because we had these anxious parents, patients, even doctors calling and wanting to know what our next step was. So this was an important element in cleft care. And therefore, what we did is we quickly had a system which would adapt to being accessed remotely, and got hold of a call forwarding mechanism and a recording mechanism and something very simple, a makeshift arrangement, but something which would really work, because this was very, very important and we did not want it to stop. And so we made those quick changes in like just 24 hours, and we had that working from the comfort of Gomti's home, which is our helpline officer. So this was a lifeline for patients, for parents. In fact, since the time of the lockdown, we've received more than about 200 calls. You'll see in the slides, please. Next slide. 200 calls from people wanting to know where they can go, how they can be helped, and what are the things that they need to do. And you see here, it's about from the time, this is from January to June, but this is about 465 calls, but specifically from March, from the day of the lockdown till today, we've received more than about 200 calls. And just people wanting to know where they can go, because see, transport and in-person contact is extremely restricted. People do not have the wherewithal to visit, and therefore what they need is that emotional connect. They need to hear a reassuring voice on the other side of the phone, just to tell them that, listen, it's absolutely okay for you to have a cleft child in the family, a born baby in the family. Help is just a call away. Our resources are always there in terms of feeding resources, in terms of nutrition, in terms of counseling, in terms of just the emotional support. So this helpline, which is a proud project of Smile Train India, because this is funded by GSK Consumer Healthcare. It's part of the GSK global partnership that we're working towards, and we're extremely grateful to GSK for this. And all thanks to them, and all thanks to this project, that people were able to connect to this. Next slide, please. So some interesting pictures. This is our helpline. That's my team who really facilitated, the back end in terms of getting a very simple equipment ready, setting up of the things in a little corner of Gomti's home, and getting everything ready. Next slide, please. So before we move on to my colleague, there are a few things that I want to kind of say here, is the fact that there are certain, for example, the helpline, I think it is very, very important that, one, we keep in touch with the patients and the communities and people, because the access to the hospitals and to the healthcare facilities were restricted. And therefore, people wanted to know, one, is how long do they have to wait? Two, if they have a cleft child at home, what is it that they can do from, say, day 3 or a day 4 or a day 5? How does one handle that? And that was all available. We were able to make that connect, and we were able to provide that. In fact, we are thinking of investing more in this, because now that we have seen, and this is going to be a new normal for most of us, all healthcare providers around the world. How do we scale up the telehealth? How do we scale up the communication between the patient patient, the parents, the community, and bring everyone together. So I think that is a great learning for us. And thanks to the support from GSK, we were able to scale up. Thank you very much.
Thank you so much, Mamta. Fantastic to hear about all those people being helped right now during the pandemic by the HELPLINE. And now we'll hear from Kimmy, our Area Director of Southeast Asia.
Thanks, Erin. Hi, good evening, good morning, good afternoon, wherever you are in this world. And thank you for joining us. And just like in other countries here in the Philippines, local government restrictions and hospital policies have limited the ability of our partners to perform cleft surgeries during this time. While there are cleft surgeries taking place in some areas around the country, it is not at the same scale prior to COVID-19. Previously, our partners in the Philippines were performing about 400 or 500 surgeries a month. But now our priority is to be able to be connected and ensure that we're here for those who need our help. Parents continue to reach out to us and expect to receive help, or at very least, advice from SmileTrain. Every single day, we receive many messages on Facebook or hotline from mothers who've just given birth. They're scared and anxious. They feel helpless. There are others who have older children or even adults who have never had surgery or need further care. And through conducting online discussions on breastfeeding, surgery, orthodontics, and speech therapy, we're able to address some of their concerns. And for speech therapy, this is what I wanted to highlight for this discussion. We took this a step further. Aside from virtual discussions, we started in April, we started offering one-on-one speech therapy sessions. And we thought that it was a great opportunity for the patients to continue learning while at home. And it has also provided an opportunity for those who were never able to travel to the centers and avail of speech services in the past. Because it's virtual, for as long as you have a mobile phone or internet connection, you can avail of this service supported by SmileTrain. We currently have more than 80 patients being given free speech therapy sessions at this time. And before I end this sharing, I would like to share a couple of videos to show the progress made by the patients. Here in the video, you will see Atasha, who is 12 years old. After only one session with a speech pathologist, you will notice the marked improvement in her speech. And the videos were only taken one day apart. Sarah, please play the video. Did you hear it? No. You get to share the sound of the computer.
Yeah, I think unfortunately we're not able to hear them right now. So perhaps
that's all right.
Yeah, perhaps we can post them along with some of the responses onto the webpage
Sure.
for the invite.
Great, thank you, thank you. Well, thank you for joining us today to hear about SmileTrain and how we continue to support individuals born with a cleft during this time. Erin?
Thanks so much, Kimmy. And now we'll go to Diane, who's going to be discussing partners across South America and resources that they have developed for care at home.
Yes, hi everyone. Thank you very much for the opportunity to tell the great work to show our great work our partners in the South America region have been doing and are continue to do. Our partners immediately responded in South America. Our partners immediately responded to SmileTrain offers to support the telehealth programs. So they acted with urgency to make sure they could support their families during these difficult times. As you can see, it has been all over the world, the same situation. Over 47 partners across 7 countries managed to provide telehealth services, consultations, and they have postponed, in the same period, they have postponed about 1,000 surgeries since March 15 until today, and they still are not providing surgeries due to COVID-19. Our leading comprehensive cleft care program in Santiago de Chile, Fundación GANS, started recording short, simple videos for parents. They explain how to stimulate and offer speech and language therapy for their children even starting at a very young age. So these videos are accompanied by a manual. They're already being used in Santiago de Chile, and precisely today, later on, we're going to be launching all over the Americas region this training for the rest of the group and the fonoaudiologists in the region to be able to show and share with their partners. So basically, during this period of time, our partners, for example, as I mentioned in Santiago de Chile, they Fundación GANS created these videos, as well as they have been providing online training, speech training for professionals. They have also continued to other partners like Fundación Clínica Noel has done working on this pilot for psychosocial. There's many resources being done with training through SAMAC, will help in train other professionals. Here you can see the videos. There's over 50 videos that are basically online. They're fun videos, easy to follow, and they help patients to improve on their speech. So they're being used currently as we speak. They're being used across Chile and soon across all the Americas. Next slide, please. So those are the videos. They even have the QR code. So you take a picture and automatically on your phone, the video shows up. So it's a really nice resource and very easy to use. You know, very simple instructions for fonoaudiologists. So it's a resource for professionals as well as for parents at home, in which they explain how to do the sound and give samples of it. Next slide, please. So here are the children working at home with their parents. Unfortunately, there's no sound here, but we can see how parents at home are taking care of their patients and of their children, and also our speech pathologists are helping and working with parents at home. Next slide, please. So this is one of our partners in Colombia, Fundación Clínica Noel. Through Telecare, they're offering, as Clínica Noel is doing, many of our partners across the region are offering several services like counseling, speech therapy, nutrition, even consultations with the doctors. That sometimes we have pictures sending us, the doctor sending a picture in which they're providing the assessment, the telecare consultation for newborn patients. You know how that calms down. And as we know, the patients are not going to receive the therapy, the surgery right away, but just to have a professional that explained to you how to breastfeed the baby and to hang in there tight. The baby has to be healthy to be ready for the surgery around 3 months. So it has been very, very helpful. In the region, we provided almost more than 1,000 consultations, almost more than 1,000 patients as well have been receiving telecare services in the different categories of nutrition, counseling, and speech therapy. And you know, many times older children and young adults struggle with self-esteem issues, even after cleft surgery. So this is very important because they have concerns about their scar, about their speech, about how their teeth look different than other children. So offering counseling for these parents and for the children, it's so essential for them to grow and have the tools they need to stay confident and to be able to smile. Next slide, please. So these are part of the resources our partners have created. This is a joint effort with Monica Dominguez in Mexico. We a licensed nutritionist, Antonio Espinosa, and a licensed nutritionist from Peru with Misión Caritas Felices. They both have helped us to put together this online course that is going to be launched in 2 weeks in Mexico, and then we're going to be doing in South America as well, because Smile Train, we're very much focused in helping our patients with nutrition services as well. So that's all for the time. So, and our South America Medical Advisory Board, they are helping us, our SAMAC, they're helping us in training professionals in the region. We did the first one on June 23rd, the first course, which was surgeries and during COVID times. And on the 14th of July, we'll be having a second course, which is surgical techniques and results in IVF surgeries. They're continuing to develop more training material. And believe me, we have a full house every time we have this kind of webinars.
Super.
Thank you very much for your attention.
Thanks so much, Diane. That was fantastic. And next we'll hear from Camila, who is also in South America, but focusing on Brazil.
Hi, everyone. Good morning. I'm really glad to be here and to be talking a little bit and showing what programs have been done during this time, challenging times that we are all living. Just to give you an overview of the situation we're right now as a country. So you can see on the map that every state of Brazil already have not only case confirmed, but also deaths due to COVID. As of this week, actually, we have over 1.6 million cases confirmed in all country, and over 64,000 people lost their lives. Unfortunately, we still haven't reached our peak, which researchers and specialists of the area says that probably is going to happen next month. Next, please. So when the first case was confirmed here in Brazil, we decided to think of ways that we could be supporting our patients and our partners. Think about our partners specifically, we created a training program along with our medical council here in Brazil that would focus on surgery, speech, and ortho. So there are 3 different types of training. We focus on specialists or professionals of those areas. Those trainings have been very beneficial, and just to mention some of the impacts. First of all, they're tailored to a specific need. So they're being open only to those centers that are new centers, new cleft centers, and professionals that are new as well at the centers. So this really is aligned with the mission of Smile Train to teach women how to fish. Another thing is that the training can be accessed anywhere. They are free of charge to everyone that is participating. The professors that are providing this training, they have vast knowledge of cleft, and they are really well known and really well respected here in Brazil. If it wasn't for this online training, they wouldn't be able to travel, and due to schedule as well restrictions, they wouldn't be able to go to those places and provide a course like this, really detailed, that has a long duration. Usually when we ask someone to travel, they can stay a weekend or 1 or 2 days during the week, but it wouldn't be able to be like for surgery, for instance, 6 weeks long of a course. Another thing that was really impactful for thinking about those trainings is that they created an environment of a classroom. Since I mentioned before, because they're really tailored to a specific need, which is new centers, the professors, the participants, they are attending those trainings. They are the same ones since class number 1 until the end. So it created an environment of a classroom for them where they're able to make questions, raise concerns they have, ask for more detailed information about a specific technique. And more importantly, it created a flexibility in terms of pace. So if the professor believes it's important to go slower on a specific topic, he's able to do that. If he thinks it's best to add new modules to the course, he can also do that. Just always thinking about what would be best in terms of giving the information to the participants to make sure that they be able to keep developing themselves and improving on their techniques and skills when it comes to cleft. The last one that I would like to mention is that the participants at the end, they will be able to have a really good overview of their areas. Next, please. So when we were thinking about our partners and the ways that we could help them, we were really concerned when all cleft centers were closed, which happened in March due to the first case confirmed of COVID. With that in mind, we created here in Brazil a telecare program that would be assisting partners and patients. The way it works is that partners are able to remotely continue to treat their patients, provide guidance and counseling to the parents, be able to perform first consultations, and assist those in need in terms of food supplies. Just to go further on this last topic, many patients are very poor and they do not have financial resources to be able to buy formula for their babies when it's needed, and not even food at the supermarket as well. So usually they have assistance in terms of getting those items at the cleft center. once the cleft center were closed, they're not able to do that anymore. So the patients were not able to provide the most basic needs to their families, to our patients, which is food. So with the telecare program, our partners are able to keep track and see what's happening with that patient. And then they come to us, Smile Train, saying, look, we need help with those patients. And then we help them, and we make sure that the food supplies and formulas are able to reach those in need. The pictures that are on this slide, they're just some of the examples of the telecare program that is happening here in Brazil. We have examples of speech, dental care, and the one on top as well, we have the family that received a bag full of food and also formula. Next, please. So the impact that we are seeing when it comes to our telecare program, all partners reported improvements on the development of their patients. The nutritionists are able to follow up closely with their patients, so baby continue to develop, and the parents, they feel safe and supported by their center. One thing that we really saw a huge impact was on those patients that live really far away from their center. That so they would need to travel 8, sometimes 9, 10 hours to be able to go to the center. With telecare program, now they could be assisted more frequently, and which improves significantly their treatment and also their self-esteem. Just to put in numbers, since mid-April to mid-June, we assisted over 1,400 patients and providing over 4,300 sessions in our areas: speech therapy, dental care, first consultation, psychology support, nutrition, etc. Next, please. So one of the reasons that we're really concerned and really wanted to help our partners when it comes to telecare was because of nutrition. As we all know, cleft babies, they have difficulties when it comes to feeding, and nutrition programs and the closely follow up of the nutritionist is very important during this time of their lives. So when we created the telecare program, many partners of ours reach out to us and say, hey, we really need help and we really want to participate with our nutritional program. So our partners, they quickly found new ways to connect with their patients through whatever social media is easier for the patient. It's WhatsApp, Facebook, video calls, Skype, so to be able to keep track on them. On those, usually what happened is that the partner reach out to the patient and say a few days before the consultation, asking information about feeding behavior, growth, current weight of the baby. And once the meeting happens with all this information, the nutritionist is able to have a clear conversation with the parent regarding what's happening, what is the current weight and what it was supposed to be. If necessary, they make adjustments to the nutrition program. And after the meeting, our partners they write everything on a text and send to the partners to make sure that the patients understood what was told them, and also so the parents can have a place to go back and get that information on the text if they need to until the next consultation. Next, please. So because the patients are not being able to be seen in person, our nutritionist has to really think outside the box on ways that they could keep seeing the development of their patients. So one of the things that they thought was to teach the parents to weigh themselves holding their babies on a portable scale at home, and then they just weigh themselves, and the difference of that would be the baby weight. Here in Brazil, many patients, they do not have a portable scale at home. So again, our nutritionists had to really find a new solution for this as well. And what they came up with was to have the measuring tape, which is easily found here in Brazil. And they teach parents to measure the circumferences of the arm or the calf. If the circumference is getting bigger, it means that the patient is gaining weight. I want to finish this presentation by talking about this patient. All the pictures that you see right now, is from the same patient. His name is Luis Henrique. He arrived at our partner hospital in Rio de Janeiro underweight, and the parents were really concerned with the feeding challenges that we're facing. The nutritionist of this partner started to closely follow up with them and to make sure that all the information was being sent to them. You can see that the parents were able to follow the instructions, and they were able to weigh the Luis using the scale and also using the measuring tape. The last picture, the one with the whole family, was sent to us about a month and a half ago. And with that, I just want to finish with the quote that the mother sent me, saying that gratitude is the word to describe everything that has been done, not only for my cleft baby boy, but better yet, for our whole family, even in a time of pandemic. Thank you.
Thank you so much, Camila. Fantastic, and I love that quote at the end. And last but certainly not least, we'll hear from Nicole Buba, who is going to speak about some of the incredible education and training programs that have been taking place virtually in Africa. So Nicole. I hope we haven't lost you, Nicole. I was on a call earlier with some of our African colleagues, and the Wi-Fi was a bit wonky, but it looks like you're here now.
Thank you, Erin. Yes,
Right.
it's okay now. Thank you, Erin. Greetings, everyone. I'm happy to present today about our tele-education initiative, which we call TeleCleft. Slide, please. Slide, please. Thank you. First, I will make the point of the COVID-19 situation in Africa. Please, can you go back to the first slide, please? Thank you. So we will first make the point of the COVID-19 situation in Africa, and then I will talk about the tele-education initiative. On CCC with WACS, WACS is the West African College of Surgeons, and on speech with SPAN, the Speech Pathologists Audiologists Association of Nigeria. Then we will see the impact of the training and close with the way forward. Slide, please. You can see in the map, we are close to 500,000 confirmed cases in Africa, with more than 200,000 recoveries. And the deaths are around 11,000. Those numbers are relatively low in comparison to the rest of the world. But if we can see that in Africa, most of the governments' preparedness and responses to COVID-19 are the same like in the other continents: wearing of face masks, social distancing, public health measures, movement restrictions. But we are facing some challenges, and the main challenge we have in Africa is the weakness of our healthcare delivery system. In Africa, you have one doctor for 1,000 people. So we also have inadequate PPE, low testing COVID-19 cases. But now, from this situation, disruptive innovations came up: telemedicine and tele-education. Slide, please. What is a TeleCleft? Our TeleCleft is an innovative cleft learning journey, leveraging e-platform to network, engage, educate, learn, and share experiences. Senior surgeon sharing experiences with the junior surgeons. We emphasize the training as it's a very important aspect of our program in Africa. The TeleCleft is a strategic partnership to sustain non-clinical and training activities for surgeons during the pandemic. You see some samples of our e-flyers invitation, which are pushed out weekly And to attend our sessions, you will need to pre-register. All the materials during the sessions are shared after. Some sessions are in French, like the speaker may speak in French, but the slides projected are in English. Slide, please. So our focus on CCC was with WACS, West African College of Surgeons. It was a 24-week training program started on April 27. 1 hour educative session done twice weekly, Monday and Tuesday at 11 a.m. West African time. The topics covered many aspects of cleft surgical care with focus on CCC. The lectures were delivered by medical professionals in the cleft ecosystem. Speakers are leading from SmileTrain partners. Moderators come from WACS executives and faculty chairs. Now, I want to emphasize this point. Continuing medical education credits are awarded by WACS for full participation to both attendees and speakers. This telecleft virtual lecture focused on CCC had a very wide-reaching impact, attracting more than 900 registered attendees from 30 countries. And the evaluation poll ranked telecleft highly valuable on content and delivery. We're still receiving demand. Next slide, please. Now, let's talk about the telecleft initiative with SPAN, telecleft speech. We signed an MOU with Speech Pathologist and Audiologist Association in Nigeria to elevate capacity and expertise in palate speech management. So this telecleft speech was a 5-week collaborative webinar series, 1 hour weekly educative session every Wednesday. Sessions were moderated by SPAN executives, just like what we did with WACS. We noted an average of 200 registered attendees from across Africa and from US. Telecleft speech was an amazing success. Next slide, please. Now, I want to highlight some points about this telecleft speech. Dr. Adeola Olusanya shared extensively on cleft lip and palate surgery and how a successful surgery impacts on the recovery journey of the patients into speech therapy. Amina Ibrahim from JSI shared about the resonance and resonance disorders among patients, how to identify them, and the latest speech therapy techniques. She also encouraged the professionals on collaborating with parents to improve the quality of speech for children. Dr. Adamson Olawale shared a very interesting lecture about the anatomy and the physiology of cleft and velopharyngeal apparatus and how these developments in surgery have enhanced the quality of cleft surgeries in Africa. Nawamaka Ezeanochi discussed the importance and strategies of proper feeding and nutrition to prepare a child born with cleft for surgery. And then the series was closed by Pamela Sharing, our SmileTrain Vice President, Comprehensive Cleft Care. She concluded the lecturers with an overview of SmileTrain speech training and treatment program. Slide, please. Slide, please. The impact of these 2 series of telecleft was huge. We have progressed on the delivery of universal health coverage during COVID. We spotlight the complex nature of the cleft condition and surgical care. The importance of multi-interdisciplinary cleft team members to facilitate a high quality care and good outcomes for our patients. CME credits, like I said earlier, a valuable point for licensure renewal. These two teleclefts were a very wonderful refresher sessions, while medical conferences are not possible. It's an initiative to ensure that education is maintained amidst COVID-19. Next slide. Way forward. Due to the huge success of this first series of telecleft CCC, we are starting the second series from July 20 till October 6. Please stay connected. Next slide. Thank you for your attention.
Thank you so much, Nicole. That was fantastic. Yeah, I think we have some time for follow-up discussion. Though I think it would be great if each of you could just speak briefly in response to these questions so we can get through them and then some of the questions that have popped up. But I wanted to ask each of you to speak a little bit about any challenges or best practices that, that you and partners or patients found when they began utilizing these telemedicine and virtual education platforms. So Kimmy, I'll actually start with you. It was really impressive to see particularly what's been happening with speech, that in some ways patients have even been able to use the time that they're forced to be at home, that they may not have had to access and do speech treatments before, and to really build up and connect with the speech therapy community. So if you could talk a little bit about the challenges and kind of best practices in case others were wanting to start those types of programs.
Right. So I think the biggest challenge we have is connectivity. So there are a number of patients or parents who don't have, regular access to the internet or mobile phones, for example. What we've done, we have a corporate donor here in the Philippines who is a telecommunications company, and they donated load cards, which basically puts money into mobile phones. So these we've given them out to speech pathologists so that before a speech session, they could give out funding for the cell phones of patients so that they could be compliant with their speech session. So that's something that was a great opportunity for us to be able to take advantage of. We are also looking at, we're actually developing other tools so that we could reach out to patients who maybe don't have access to the internet, and hopefully we'll be launching other exciting programs within the coming months.
Fantastic. Now that's a great alignment too of multiple different partners, SmileTrain and the corporate partners, and then obviously our local partners of patients. Fantastic. And we had actually received a question from Julian Gorbuth that was directed at Camila, but which I think you answered in some ways to Julian Gorbuth from the WFSA, asking about phone and internet access and whether that's available or whether SmileTrain is providing support with those. So that's really fantastic. And Camila, to kind of follow on that, I'll come to you next because it's pretty incredible to see 4,300 treatment sessions in Brazil and more than 1,000 patients treated in such a short amount of time. So if you could speak a little bit as well about perhaps connectivity and whether most people do have connectivity in Brazil, or there's anything we're doing to help about that. But then also, how do we get the word out so that we're able to connect with that many patients and in such a short amount of time?
So when in terms of connectivity, yes, that's a challenge here for us we have many partners saying that some patients, they were not able to have internet at home. That's why they try to use our partners. They are fantastic. They try to adapt as much as possible, thinking about the situation of the patient. So they use several social medias, WhatsApp here in Brazil. They have many companies, telephone companies, they put WhatsApp for free. So usually WhatsApp is the main way to connect, but going further with this is definitely something that we need to keep thinking. Right now, as a SmileTrain, we're not helping any patient or any partner when it comes to internet connection, but it's something that perhaps in the future we're gonna need to start thinking about this and see ways that we can assist our partners with that.
Super, thank you. And then in terms of getting the word out so that we have 1,000 patients getting access to these surgeries, how, are there any best practices or things that you've done to really get that kind of uptake?
Yes, about that. Again, our partners, they are incredible and really engaged, and they're really concerned about their patients. So they have a schedule at the cleft centers that was, our patients that were supposed to come in. So what they did when we went to our partners saying, we have this telecare program, they reach out to their patients that are supposed to be starting going to the cleft center in person. So they reach out to the patient and said, hey, we're going to be able to help you with Smile Train, assisting us with a telecare program. Do you want to do this? How we can help you with this? What kind of ways? What kind of time? What platform is best for you? If it's WhatsApp, Skype, Facebook. So our partners were the ones that really spread within their patients, but also our marketing team here in Smile Train with Gisele and Juan, they also did a fantastic job getting this message out for sure.
Awesome. Thank you, Camila. And Diane, you had pretty incredible numbers as well of patients accessing telecare services, and like Camila in our other regions, quite impressive work around nutrition to ensure that cleft children survive and are healthy enough to receive surgery as soon as it's safe to do so. So I was hoping you could provide a little bit, any best practices as well that helped these messages reach patients and get them looped into telecare.
It amazes me, Erin, that even though we're in different regions, we face pretty much the same challenges, no?
Mm-hmm.
You, Kimi, I hear you in Philippines, Nicole, Africa, well, Camila, we're just next door. In a way, I'm in Peru, she's in Brazil, and Mama and Mamta in India. Our partners did a great work. Kind of like they were already warming up and they were thinking of ways of starting to provide telecare when we right away jump with support, so that made it possible, So basically, I had beautiful stories in, even Troy came up with, share with us that this young couple in Colombia, in Medellin, had a baby, and how they contacted our partner and the surgeon as well as the pediatric dentist, provide them with consultation on the phone. So that was such a relief, and he posted in social media. So that has been very comforting, very, very rewarding for us here to see how many patients are receiving different kind of services, nutrition when needed, counseling, speech, so even orthodontics, some of my orthodontic partners have told me that the brackets have broken or they needed some sort of guidance. So here they are to provide, because as a parent, and more so a new parent has a baby with cleft, it's difficult what to do. So to have a professional to give you some advice, and now the tools exist. I was talking to one of our partners. I'm currently in Peru. The law for telecare in Peru has almost 20 years, but they have not been doing anything about it. And it's that now Smile Train has provided this support that in all our countries, the law exists, but they were not providing the care. So with Smile Train support, this has become a reality.
Yeah, no, that's fantastic. I'm so proud of all of our staff and our partners around the world. And Nicole, going to you next, the numbers that you showed around the demand for these types of trainings was just incredible, with 900 plus registered attendees, the desire for another set of training sessions, and obviously the collaboration with councils, which is really important, and which some of the other panelists like Camila touched on. So if you can just chat a little bit about how and why you think these programs were so wildly successful, and what other regions or partners should consider doing if they want to duplicate these types of efforts.
Thank you, Erin. Just let me share this assertion from one of our attendees, who is a nurse. She's from Cameroon, and she will even present herself on nursing post-op care next week. She said, the telecleft initiative was an eye-opener for me. It was the first time I have witnessed and participated in one of such. I learned what others do in Africa, and for once, I felt proud of how far Africans have progressed in surgery as a whole and a cleft surgery in particular. I think this can summarize my answer. It's really worthy to run this kind of telecleft program. And what I want to add is the needs are real. If you don't start, you will never know how important it is for our partners. So given to those reasons, I think it's really worthy to continue this series.
Yeah, that's fantastic. Thank you so much, Nicole. And we had a comment in the chat as well about the 2020 International Month of Hearing and Speech with SPAN and Smile Train, and just all of the incredible work that our team has been doing. And there was one other question I hoped you could answer before we move back over to Mamta, and that is, are you using any learning management software to help organize the trainings, or where is the majority of this training taking place? It seems like such a big undertaking to host this many trainings. So how is the team managing it?
It's a meeting on Zoom.
Mm-hmm.
We all connect on Zoom. So both speakers and attendees, it's like webinars, like meetings, not a webinar. So all the partners connected at 11 a.m. and we run the session. So all the materials during the sessions are recorded, and then we can share to ensure continuing learning to the attendees. So we share, we record the sessions, we share the PDF slides, both in English and in French, with the attendees after the sessions. I hope I answer your question.
Thank you so much.
Thank you. Please, can you unmute?
Thank you, Nicole. Back to Mamta, who started it all.
Thank you.
Thank you so much, Nicole. I think the helpline is such an incredible resource, and yeah, I have heard incredible stories of patients whose lives have literally been saved by being able to reach out on the helpline and to get the information that they need. So I would love to hear if you think this type of resource is something worth scaling elsewhere, and what the best practices you've seen or challenges you've seen are.
Right. So absolutely right. I think the biggest challenge for us was because we had never imagined that, the world would be in a situation like this, and we would have had to adapt so quickly to, making everything accessible, not from a standpoint of having like a brick and mortar office and having that device which will help for a helpline, because see, helpline was all about like a server, a device, a recording mechanism, a follow-up mechanism, and so on and so forth, which was very tangible. Now here we were not given much time, and we had to convert all of that into a remote access situation. So yeah, so we work quickly. I think people who want to start and want to scale up, I think the key to this is that have something which is invest more in technology, have something which is accessible remotely, and that is the next step. In fact, that is what we are planning to do, and we are doing. Supporting the software, supporting the device to be accessed remotely, and to have a system of a follow-up mechanism of recording everything. Because remember, this is a great system to have, but there has to be a closure. So yes, calls keep coming in and patients are being helped, and some of the patients are being told to hold on, so they wait and everything. But the idea is to keep periodic checks with them, whether you're doing it in 2 days or a 1 week or something. Even if they don't call, we make it a point to reach out to them and call, because remember, these are a very volatile situation. People are very vulnerable. There are a lot of, in any case with this COVID-19 going on, there are a lot of mental health issues. People are stressed out in any case. And then to have a cleft child, to have a cleft baby. I mean, we've had some heart-wrenching stories where there was this young girl young mother, and the mother herself was not more than 19 years, and there was her firstborn. And the minute the child was born, she was abandoned by her husband and by, you know, her family. And then she had nowhere to go because, you know, in this pandemic, there are also travel restrictions and she was not able to go home. So she checked into, you know, a neighbor's place and a friend's house. And that's when they told them about Smile Train. And then she called, and now, you know, Gomti is her friend. Gomti is the helpline officer, is the lifeline, because she's, even if she's nothing, you know, specific to ask, she just checks in with her and says, okay, probably, you know, 2 weeks from now, or, you know, some nurse will call her or tell her about feeding, or somebody else will be in touch. So I think the important thing is also closure on things. The important thing is follow up. And it's amazing that we at Smile Train has been able to do it with GSK help and all of that. And, you know, we are looking forward to scaling. I think it's fantastic in a country like India where, you know, everybody has a phone. Yes, internet is a huge challenge. We all spoke about the speech app and other telehealth projects. I think here, getting a smartphone or having a video or having internet connectivity is the key, because, you know, these programs are dependent on technology. But this kind of a low cost setup, as in a helpline, does not need internet. And it just needs a small phone. I mean, and the phone connectivity is available throughout the country. So I think even a voice connect or a voice call is important. And I think it's very easy to do and everybody can do it.
Yeah, no, that's fantastic, Mamta. Yeah, and I was excited to bring it back to you because there are so many, you know, complex and internet-heavy solutions that are clearly needed, but then solutions like this that just require a person who cares and has knowledge on the other end of the phone are so impactful too. Yeah, thank you. This has been so wonderful. We have about 5 minutes left, so I wanted to briefly ask each of our panelists to speak a little bit about what's next. Telehealth and virtual training have always been concepts in the global health community that can be used to overcome barriers to care. And I think we've all seen, certainly in COVID, the COVID-19 pandemic, how essential they are to the cleft population and to treatment. My sense is that both the pandemic is going to continue for some time, requiring all of these resources to continue to be available. But it sounds from all of you like we're hearing as well that there is incredible demand for patients that are at long distances, even if the pandemic is not here, or for partners to be able to come together at an agreed time and learn every week. So I wanted to just briefly, in about a minute or so, hear from each of you about, yeah, well, what do you think is next? And Mamta, I'll start with you.
Yeah, so I think that, you know, this is a great opportunity. I mean, a pandemic like this is both a challenge and an opportunity. And I think all of us at Smile Train and all of my colleagues here are very lucky because, you know, we've quickly adapted to the new situation, and we've quickly thought about solutions which, you know, are readily available, and we acted on them very quickly. So I think the way forward for all of us, and specifically for the Asia region, is that we've actually utilize this lockdown to strengthen training support for our medical professionals. I think training is the key, and otherwise in normal situations, we would not, you know, have the resources. I mean, we have limited resources, so we, you know, getting everybody together in a conference or some training and learning opportunities is both very, very time and resource intensive. So we've used this learning opportunity. In fact, we've already done about 10 webinars, whether it's a VPD surgery or whether it's just, you know, handling surgeries in this time of COVID, the anesthesia or the PPEs. So some technical sessions we've had on surgery, we've had technical sessions on speech therapy and orthodontics, on nutrition. So I think we've utilized this time for training professionals, just not the surgeons and the doctors. I think we've also, you know, gone down to train and teach people for outreach, for nutrition, and these important elements. So I think these are important elements of cleft care, which are all woven together. And this is a great opportunity to use the lockdown to deliver education. And we've been able to do that.
Wonderful. Thank you so much, Mamta. Nicole, I'll pass it over to you next for some final thoughts.
So like I shared on my presentation, next step, The second series will start on July 20 for three months again. And please stay connected. The best is yet to come. We will continue to create, to innovate. And instead of seeing the glass half empty, we are seeing the glass half filled. That's the good way for me to summarize this situation. We are creating, we are innovating, and please stay connected. Kudos to Team Africa.
Indeed. Thank you, Nicole. Diane, I'll pass it over to you next.
Really quickly, yes, I agree with Mamta that challenging situations brings a lot of creativity on our teams, and I've been able to lean on the support of our brand new cleft leadership center for them to help provide training to professionals, and of course our South America Medical Advisory Council, who have been very active, and we have been providing care and being there for our patients, our parents, but also for our professionals, you know, because we're taking this time to train, to provide free training and high level training. So we're constantly there for them and listening. Our SAMAC has been gathering more information as to what are the needs in the region, and that's what we're given to. And as I said, we have full house in all the presentations we're doing, you know?
Yeah, the demand is clearly there. That's fantastic. Kimmy?
Hi, thank you. Yeah, so like just what everybody else said, this situation has forced us to think out of the box and think of new ways of doing things, using technology or creating ways or thinking of new ways to be able to provide services to our patients who are in far-flung areas or remote areas who have no access to the internet. So yeah, so like to echo what Nicole said, the best is yet to come. We are going to have new programs. We are going to come up with new ways of doing things. And the important thing is that the patients are our focus, and we want to be able to provide them with the services that they desperately need.
Fabulous. Thank you, Kimmy. And Camila, I'll throw it to you next.
Yes, for me, I think here in Brazil is very similar to what everyone said. For us, we have the ability to have online training for those that need from our partners. You know, it's amazing. And continue with the telecare, just have that as a tool that we can reach out to patients that either would travel long distance to go to the cleft center, or the ones that cannot even get there. So to have that tool to be able to reach them and be able to help them, I think is going to be really something that came with this challenge, with this pandemic, and it's going to stay, and we're going to be able to find new solutions with everything that we learned from this pandemic, and be able to use so we can continue moving forward.
Fabulous. Thank you all so much. Thank you to our incredible panelists. We were so happy to hear all these amazing and uplifting stories. You know, with everything that's going on, there's so much good happening too. And I'm so proud of our team and our partners. And sincere thanks to all the panelists, but as well to all of our participants. We had so many people, and we were thrilled to see such an active chat and Q&A. There were some questions we couldn't get to, so we'll answer them on the event page. But we also just want this to be the beginning of a dialogue. So my colleague Sarah Hamilton posted in the chat some email addresses so we can continue the conversation. Don't hesitate to reach out. And we're so grateful to have all of you here with us today as well. So thank you, everyone. Be well and have a great day.
Thank you very much.
Thank you.
Bye-bye.
Thank you to everyone.
Ciao.
Bye-bye. Bye.